I'm strongly of the opinion that every healthcare provider who sees someone with a rare disease should at least screen them for mental health conditions. Given our findings that people with rare diseases are about 70% more likely to experience depression and anxiety, they are at risk. So checking in with them either by having a conversation or using a validated screener, and actually engaging in action if you find that there is a challenge there. So there are lots of social workers and psychologists who could broadly support people with rare diseases, especially people with expertise in health psychology or who work with chronic diseases. Unfortunately, there are almost no mental health practitioners who specialize in rare disease. And our research does show that rare diseases have these extra challenges, this extra stigma and things like that. So I really want to encourage, policymakers and, educators to increase the focus on training healthcare practitioners and mental health practitioners for these specific challenges. This is especially true for adults with rare diseases. Those who are familiar with the rare disease space might be aware that there are often better resources for children. And then there's a big challenge with transitioning to adult services. And sometimes the transition doesn't happen at all. So there are very few providers who would have specific expertise in the mental health of adults. Another thing that I really want to amplify that Marla said is the role of peer support. So as Marla said, there are lots of support groups and organizations for specific rare disorders, and also ones for, more general collective rare disorders. And given these similar challenges that we're finding related to stigma, people with very different rare disorders actually have a lot in common in terms of these psychosocial challenges. And they can really get strength and empowerment from each other. So that's another thing that I would recommend healthcare providers do, is encourage people to find a support system of peers like them.